Streamlining digital records in healthcare can significantly improve patient outcomes and medical efficiency. It's mission critical that clinicians have access to the necessary information at the right time. But what does it really take to integrate primary, secondary, and community care seamlessly? In this episode that I recorded at Digital Health Festival 2024 in Melbourne, I speak with Chris Lucas, Vice President of Digital Care Records at Orion Health. And in this episode, we talk about the development of shared care records and health information exchanges, how to use AI and machine learning to manage unstructured clinical data, and the global impact and real-world applications of Orion Health solutions. Collaboration starts with the conversation team HealthTech. Let's make it happen.
Welcome to Talking HealthTech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
So Chris here at the Orion booth, thanks so much for having me.
Oh, thank you for having me.
Yeah.
Oh, it's a really interesting time. There's a lot of really great energy here at the show. It's really got a vibe to it, and there's lots going on. So it's fantastic to be here.
Excellent. Look, firstly, set the scene. Tell us a little bit more about you and what you do at Orion.
Here at Orion Health, I take care of our digital care record, and so that encompasses our health information exchange, our shared care record, and that's more of an English-style health information exchange, a bit more depth to it. It's a very interesting capability that we deploy there. And in Canada, for example, we also do a clinical viewer and a viewer that effectively connects to existing systems, surfaces all the data in one place. Again, very similar kind of outcomes to a health information exchange or a shared care record. Technology is a little different, but we tend to cover all of that off.
Yeah, interesting. And so, Orion's got that global presence as well, and out of New Zealand, because we know that, because you're here at the NZTE booth. So tell me about what you're seeing in different parts of the health ecosystem in that kind of HIE space, and then we'll kind of dive it specifically into Australia. I think getting that global view might be pretty interesting.
Leading up to COVID, there were a lot of health economies that had figured out the value of being able to bring information together for the purposes of direct care. So enabling clinicians to understand what was going on with an individual across the patch, jurisdiction, local health economy, however it is. We've seen some really notable examples in Canada who are early movers to have a clinical record across provinces. In the UK, England in particular, there's a shared care program that's been going on for a long time now. This started out around 10 years ago, and they've matured along, they've built a lot of capability, and it's not just about the clinical aspects, which a lot of health economies focus on. There's the clinical aspects. That broader sense of, here's the other care elements, such as the social determinants. They have social care systems, they have local counseling systems that also have information about individuals. It's really important to being able to provide more of that holistic care.
Yeah.
And that's been progressing along, and that's evolving. It's a very interesting space. Obviously, in Australia, there's been the PCHR, which become the My Health record. That's evolved. Each state has a different, vendor and a different strategy that they've taken to deploying a localized health record, and now that's seeming to get a lot more focus. It's coming together. We can see there's a lot of investment, both from a technology perspective, but also the legislation to be able to support enabling having the care information to come together, not just on a state-to-state basis, but being able to share beyond that. I can definitely see, the strategy papers are really interesting. We've seen some wonderful speeches from, the centre explaining, here's the progression, and we're really looking forward to seeing some of this architecture content that will help us solidify our understanding of the things to come. And in that respect, it's a very exciting time.
It sure is, and that was a great kind of overview globally around that the world of health information and the role that kind of shared care records and HIEs play. I think it might also be helpful for people maybe not fully immersed in the space, because many would know in say a hospital setting for the clinical kind of infrastructure. Everyone's got an EMR, and they've, that's how data is kind of stored. Or maybe they don't have an EMR necessarily, but then the role that we're talking about, HIEs and shared care records, are these on top of, inside, or kind of instead of? What's that kind of, or it depends?
It depends. And that kind of comes down to when they were implemented. some of the, the technology trends at the time, the standards or otherwise that were being embraced. But, I mean, long and the short is, most of the time, it starts out with joining up all the hospital records, having all these different EMRs, forward information to a shared store. And that's the simplest way to describe it. There are lots of different hybrid models or otherwise and federated examples, but it's easier to describe it that way.
Yeah.
So it starts out with those hospital systems sending data to one place, and then what often happens is there's a understanding that the primary care information is absolutely pivotal to those who are hospital care people that have arrived, so getting the information as to what's happened in the community.
Yeah.
Sometimes it's, with GPs, other times it might be some of the social care. Maybe there's mental health and addiction services that have some understanding of the individual that's actually really important to that holistic care of them, and all the treatments that need to go alongside that. So it often starts out the secondary care, but just simply volume, based. There's a lot going on there. There's a lot of value to be had. Throws out into primary care, and then often starts reaching into some of the community areas, pharmacies, other kinds of allied services, and just being able to bring as much structured information together as possible. And so once you get to that point, you can start doing more useful things like, well, now I can see the lab results from 4 or 5 different places. I can trend those now, and I can understand what's happened. If you could think of the past, maybe you might have been able to send out and gotten paper versions of those records. Okay, cool. Record A, B, C. Now I have to figure out, okay, what was the trend over time from those? This takes all of that out of it. And I mean, it's not as simple as that. There's all the other aspects that need to go alongside it. But it's a simple example of how it's useful. And, lab results, probably 80% of the decisions made about someone's treatment comes down to lab result and an observation.
Yes. Yeah, absolutely. Yeah, you've got to put the information together, and really importantly, the historical over time to be able to make informed decisions. And you touched on this earlier too, that it's not just about the decisions for that particular clinician that needs to be made, but this concept of holistic healthcare. And you also mentioned the social determinants of health. So it's not just necessarily about, the healthcare and the medical side. There's much more that something that might just sound like a behind-the-scenes infrastructure thing that needs to happen. It's actually informing better patient care at that holistic social determinants of health level. Tell me a little bit more about how you're thinking about that at Orion.
Look, it's really key. So, if you know that an individual has challenges with transport, or maybe there are aspects of, their mobility, you can start to make some plans for, okay, so these things will work for them, these other things perhaps won't. Or I need to take special care with actually the dispensing of this particular regimen of treatment because, simply put, it's going to be really challenging for that individual. It starts at that end of the spectrum and then moves into the other aspects as well, such as, maybe these people aren't located somewhere where it's easy to be able to get to somewhere for medicines to be dispensed. There's lots of examples. Unfortunately, a lot of them tend to be on the, on the sadder side of and realistically, if people can think ahead and know that little bit more about a person, they can do a better job of caring for them, of scheduling appointments, understanding this will work for them, this might not. The other challenges that get in the way of people getting care when, they've got all the other things going on in their life they need to worry about as well.
Yeah, look, that makes so much sense. I think about my own personal experiences in any kind of healthcare setting. What you say is what we would love to do in healthcare in terms of, understanding where that person might be. And I understand in different parts of healthcare that's more the priority. However, I don't think that's ever happened in the care I receive. Often it feels like the clinician is just getting by and doing what the computer tells it to do, and it's kind of the concept is there, but in terms of the delivery on a day-to-day, it's not easy to do. It's not kind of this disparate systems. How do you take the vision and then kind of implement it for the clinician?
Oh, yeah. So it's really important to have the information available at the right place at the right time. Now, these health information exchanges, shared care records, are secondary systems for clinicians. They're not the system they use every day for the most part. They have to go, well, actually not go, but they have to invoke that system and have the information presented to them. And it becomes routine, but we have tools that we've developed and capabilities that make it easier for them. So single sign-on, so that from their EMR, from their GP systems, one click, they're straight into the record. They can see your patient information. All the right auditing, all of the right privacy mechanisms still exist, but that way it takes some of the load off. And little things like that make a big difference.
Yeah.
So it makes it easier to get access to the record. We also put a lot of emphasis into our UI, UX, and making it really straightforward to use the software as much as possible. So we've gotten really good feedback around some of the modern capabilities we've brought in. There's actually a lot of science behind the decisions we've made around how the UX works, how the experience flows, how we put the right information in the right spot. And so, we get really good feedback around that, and we can see that we can build upon that and do a better job. From my perspective, we're kind of the opposite of e-commerce, right? E-commerce, it's all about how long can I keep them on my site?
Yeah.
My view is I want them to use our software as little as possible. I want you to get what they want, move on to giving care. Because I'd much rather they spend that time with someone giving care, being confident they have the information that they need, and get the job done as well as they can. Because, look, there's so many people in the clinical setting are stressed, tired, overworked. It's a distraction from the actual job of caring, which probably a lot of them, that was the thing they really got into the industry for.
Yeah. Not
the overhead of, look, I need to take these notes, I need to do this, I need to do that. And with that as well, some of our projects have been pushing towards some of the AI. I'm very mindful about the term AI because, it's used like a weapon, I feel.
Is it Orion.ai now? Or?
Oh, no, not Orion.ai, but we've had ongoing research into, machine learning, large language models. Look, I'm an engineer by background. I look at a lot of this stuff, it's just really good statistics with really tailored computing capability.
Yeah.
And so, we can do things like we can walk through an entire patient's records, we can pull out all the appropriate terms or the clinical terms, we can map those, we can work through things like negation, so someone says no family history of, which is something that clinicians are all trained to do, is to, iterate through the things they've eliminated, and we can actually have that in the presented in a way so that here are the terms that are actually important in the record as opposed to here are the terms that are mentioned in the record.
Yes.
And so we can walk through the unstructured content, and there's a lot of unstructured content with really valuable insights in it. And a clinician can simply get to the stuff that's important.
Yeah.
Maybe they're interested in a particular specialty and a particular problem that happened. One click, now I can see all the documents that have that term in it, and I can quickly work through that rather than trying to rustle my way through it all. We've also been working with generated summaries as well. So, have the machine work through the patient record, figure out, okay, these are the terms that are important, write up a written summary, 250 words, 350 words, that kind of thing. They can get a quick overview of some of the key aspects, and they can drill into that. And we work with another organisation that specialises in that space. They have a clinician in the loop as well, because we're extra mindful about how these things are applied, where they fit, the trust that people have in our systems, the trust that people need to have in the technology as it evolves. So,
super important. But I'm definitely excited about that potential around we always talk about as soon as we do structure the data, then we can build up the information and then we can do something useful with it. But the potential for everything that has been collected already in that unstructured format, then hopefully there's a lot more value and insights that can be gleaned historically. And that's an exciting future ahead. In terms of other things happening at Orion, look, I've been out and about at events around the world. There's always an Orion presence wherever I seem to go. So a lot's happening globally. You kind of touched on a little bit already, but tell me a bit more about what we can look forward to seeing from Orion over the next 6, 12, 24.
Okay, so very, very recently, we've just finished up the deployment of Saudi Arabia in HIE. So that's going to join more than 5,000 providers into all of their data into a single record, over 35 million lives.
Wow.
And that's making pace and onboarding and starting to get the first returns and benefits on that. I was lucky enough to be at HIMSS and see a talk given by the folks from Saudi, Malafi as well, obviously adjacent. They've been rolling out some of our technologies as well, part of the Riyadh Gulf Exchange, so the different HIEs are able to exchange content so that, if you move from country A to B and the clinician can see that information. I touched on Ontario a little bit, I think, earlier. Look, that's really interesting. A very progressive part of Canada. They're in the process of working through modernising their technology stack, bringing the very latest in standards to all of the suite, and replacing what is effectively a group of disparate clinical viewers that are looking at a pocket of information, clinical information, across their province. And what we're doing there is we're deploying a single instance of our capability. We're bringing all that data together. It's a wonderful program of work. Lots of interesting developments as we move along. They're bringing in international patient summary. They have a rich history of lab results and other clinical data that they've been housing for more than 20 years. So they have a lot of depth there as well. And then with that, we're also bringing in a patient portal as well. So that's being deployed adjacent. And so that means now, once the project gets to the point of fruition, clinicians and patients will be seeing effectively the same information and might not be presented exactly the same way because, you have nuances. You want to have the information presented the right way for the right people, but the content itself is the same. And so that means, both sides are seeing the same information. Consumers, their carers, right the way across the spectrum will be able to actually leverage that and advocate for themselves and, have better care. Not saying that they wouldn't get good care, but informed makes a big difference.
Yeah, absolutely. Well, this is what we talk about all the time, right, at these types of things. That's awesome that that's the focus and that those are the priorities, a lot of work to do, but obviously some real demonstrations that you've got there. So, mate, we'll put the details for Orion in the show notes of this episode. People can get in touch, see you at an event, see you somewhere around the world, and really thank you so much for having me at the booth today.
Thank you very much.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.